Hello, I'm Matthew Weinstock with a preview of the March issue of Hospitals and Health Networks. Our cover story examines how telehealth seems to have finally gained critical mass and is changing how hospitals connect with patients. Here's editor Bill Santamore with a closer look.
It's really fascinating to see how the whole concept of telehealth is maturing and how hospitals are making the most of it. The March cover story by Jerry Aston looks at how hospitals are finally harnessing the potential of telehealth to truly care for patients in ways that are not only more convenient, but also more effective at promoting health and preventing illness and hospital readmissions. The trend is picking up steam as hospitals dive deeper into population health management and risk contracting. It's also fed by consumer demand and the understanding that you better provide people quick and easy access to your organization wherever and whenever they want it. As one expert puts it, if you believe that your future is only serving people through your brick-and-mortar buildings, you will be marginalized. The story provides real-life lessons from hospitals that are instituting everything from electronic consultations to patient rounds that use smartphones for loved ones who can't come to the hospital. There are examples of EICU and telestroke programs, and even teledermatology and telepathology. And we examine some of the obstacles still out there, especially around reimbursement and physician buy-in.
Thanks, Bill. So the March issue also includes a couple of features that detail the important steps hospitals are taking to improve environmental stewardship and safeguard buildings from natural disasters. Leanne Drew's article on greening the OR, for instance, looks at how sustainability programs not only reduce waste and protect the environment, but can contribute to a healthier bottom line. Between 2010 and 2013, Johns Hopkins Health System in Baltimore saved more than $5 million on an OR reprocessing program. But it's not just about recycling and controlling those waste streams. As UCSF Medical Center's Susan Ryan told Leanne, sustainability in the OR really involves a culture change and educating staff on the benefits of reducing those waste streams. In another feature, writer Amy Eagle explains how hospitals are turning to something called resilient design to shore up their facilities against natural disasters. We're talking about buildings with windows that can resist winds of up to 250 miles an hour, and infrastructure connections that are buried under the ground so that they're less susceptible to being damaged by wind, rain, and other elements. And finally, we have a report from a roundtable discussion where hospital leaders and CDC officials discuss some of the best practices for implementing an antimicrobial stewardship program. So for those stories and much more, be sure to check out the March issue of H&HN. I'm Matthew Weinstock. Thanks for tuning in.